little raise hand button at the bottom of the screen. So feel free to just type that as it comes up. And I think we're all set to go. So thank you everybody for joining us. We know everybody is super busy right now, so really appreciate you taking the time to talk to us today and hear from these experts. I'll let everybody just introduce yourselves and give a brief introduction to what your organizations are doing right now. Joel, do you want to go?
Sure. I'm Joel Berg, CEO of Hunger Free America. I want to thank Dr. Samuels for joining us and Dan Giusti for joining us. I really appreciate this, and thank you, Nicole, for hosting. Many of you know we're a nationwide anti-hunger advocacy and direct service organization based here in New York City. I'm coming to you out of my living room in Brooklyn. I know a lot of people signal their virtue with their books in the background. I have my box sets, my music box sets in the background. For any of you under 30, I can explain what a box set is later. So what we're doing in this deadly crisis is both direct service and advocacy work. We don't directly distribute food, but we help people learn where they can get food through our National Hunger Hotline. We help people understand how and help sign people up for SNAP and WIC. We recruit volunteers and skills-based volunteers working with places like the Campaign Against Hunger to help engage volunteers in the most impactful way possible. We promote things like school breakfast and the summer meals program when those exist. We have a nationwide VISTA anti-hunger programs, part of the AmeriCorps National Service Program, where people perform full-time community service for a small stipend. And then we do advocacy, direct service, advocacy, policy, and community organizing work to really create the public policies, the government policies needed to end hunger. Our belief is that charities should fill in the gaps, and people like Dr. Samuels do just an incredible job with ridiculously little resources and deserve to be championed as heroes, but they cannot possibly solve this problem. We need a country with more jobs, even before this, higher wages, and an adequate safety net. So we spend a lot of our time and energy pushing to get that as well.
Great. Dr. Samuels?
Hi, Melony Samuels from the Campaign Against Hunger that is located at 2010 Fulton Street. We are an anti-hunger organization that have been serving New York City for, as I said, 21 years. Our scope of work goes to 150 zip code in the city. Now since COVID-19, much further, we serve areas such as Queens, deep end of Brooklyn, South Bronx. We have a wraparound service, a holistic approach that we offer families so many different things that would help them, somewhat of a one-stop shop. We can look at it that way, in the sense that an individual can come to our organization and not only receive food, but they're able to get their SNAP recertified also. We do taxes when during its season. Right now we're doing census in spite of what's going on. We have a robust urban farm that we work with youths in the area, teaching them skills, entrepreneurship, teaching them how to peer-to-peer relationship, working in farmers market. We have been successful to infuse about 16 to 20,000 pounds of food via the farm into the community, whereas our super pantry, we will do 3 million meals annually. And in addition, we have our cooking classes, cooking demo, an average of 600 annually. We work extensively with Hunger Free America, whereas we get help, as you heard Joe says, with volunteerism and other areas of technical support where needed. But in other retrospect, we do a lot of benefit access to families that are in need. And so with a holistic approach, we have several partners that we work with, whether it's from our senior centers, we work with the public schools, and we work with hospitals, and we have also an amazing mobile farmers market that goes across Brooklyn as it is right now through a Vital Brooklyn grant we received from Governor Cuomo. And so we have been able to actually bring healthy approach to families, far more leafy vegetables, because we understand that hunger is a problem in our city, but we also I like to look at the fact that we're also dealing with other crises, such as there's a lot of families that are diagnosed with diabetes, hypertension, obesity. So we find that something has to be done. And one of the things the Campaign Against Hunger worked diligently to do is make sure that we have healthy food and healthy approach. And that we've been championing from 2009. We have worked hard to make sure families understand, and not just families, but where policymakers are concerned, that we don't just need food, we need to make sure that our families, not because they are immigrants or Black and brown community, not because they're at the poorest side of the food chain, that they should just get anything. So we are championing there, and we will talk further about what we've been doing and what we've been seeing since COVID-19, especially now. Thanks, Joe.
Thank you so much. Dan, if you just...
Yeah, my name is Dan Giusti. I am the founder and CEO of a company called Brigade. We're a company that essentially, in a nutshell, is taking professional chefs that would otherwise never really choose to work in institutional food service, and find ambitious people, train them how to work within federally reimbursable food programs like the National School Lunch Program in public schools. We've recently expanded into senior centers, recognizing that these programs are there, they're funded, but usually not a lot of attention from professionals who are trained to cook are going into those places. There's a whole bunch of people who spend a lot of time working and have spent a lot of time working in these places, and it's a really difficult job. They haven't received a ton of training themselves. They're working with really challenging parameters. So our whole goal is to work with these organizations, to work with their teams, and try to bring whatever we can to the table. So whether that's training them to cook, whether that's helping them reorganize themselves, but we look at it very much as a collaboration. We started in New London, Connecticut. We started working in the Bronx the past couple of years, and working with really the New York City public schools to understand how things can change over the whole district. We started working in Richmond, Virginia this year, and we just started working in Denver public schools. So again, our goal is to figure out how to work with institutions and just bring kind of a culinary presence to, again, take full utilization of what is a program that's already existing and is well funded to feed people.
Great, thank you. So I just want to get started by asking Dr. Samuels, about the work that you've been doing recently. I saw on the Campaign Against Hunger website that since March, you've served 150,000 people. Are you seeing that number continue to rise? How is it going as of this week?
Nicole, I tell you, when I repeat the numbers, I too have to wonder if it's real numbers. We're presently approximately 190,000 individuals that we have been serving since March of this year. We have already distributed over 1.8 million meals in 6 weeks, basically. It's unbelievable. I asked my staff this before I came on board. I said, I want you to check last year, this time, the exact date and time, which was the 27th, basically, of April to the 1st of May. And I want you to tell me what the increase is like. And after they did the math, they said we're presently serving 671% more than what we served last year. So the math sounds difficult, but it's real, because we are in a devastating time. The crisis is unbelievable. The resources are dwindling down. I don't think a lot of individuals understand how great the need is and how hard it is to access resources, and it should not be so.
Great, so we have actually a question that I think would just be relevant to talk about right now. Somebody's asking, are you serving meals through the federal program or charitable meals, or a mix of both?
Okay, so it's not actual meal. We have pre-packed bags, it's grocery bags that families have to prepare for themselves. And one of the things I want to add in our distribution, we make sure that we meet all the food groups, from the lean, some cases lean meat, or making sure that the protein is there, the whole grain is there. We make sure the carbs is there. We are very cognizant of the need. Or fresh fruits and vegetables there. So we are cognizant of the need, but not necessarily we have not been making pre-packed bags, pre-made meals, because it's just totally impossible. We have been asked many times to do so up to yesterday, and we said, no, we do not have the infrastructure right now, and we just have to leave that to the soup kitchens to jump in where that's needed.
And in the terms of the question about your source of food, you get some food from the federal government through the food bank, correct? Some state and city food, correct? And also private donations. Is that accurate?
You are accurate, Joel. We do get those. Those entities have been supporting us. But I tell you what has been keeping us. It is the donation from simple families, citizens, from $5 up that has been causing us to still stay in business. We have not, what has been trickling down is not enough. And every week we go through the same challenge. What are we going to put in these bags? And it's been overwhelming. And we are presently telling individuals, you cannot, because we have now, and I'll address that soon, we have moved into a warehouse space for distribution. And by moving into a larger warehouse space, it gives us access. One, social distancing is possible, more volunteers, we have hired more staff, but we don't have access to enough food. And it's been an ongoing problem that needs to be fixed as soon as possible.
And frankly, an even bigger challenge than food is money, right? We don't like to talk about that, but the truth is, for people who want to donate food, it's far more effective to donate money. And lots of the government programs provide food, but don't pay for minor little things like keeping your lights on. And so we always want the feel-good focus on food, but on your behalf, I'd say you and groups like Hunger Free America do need actual money.
Yes, and like I said, the capacity of where you have to understand, you're taking an organization that has been very, very, very committed to the mission. And we started out addressing the needs on a daily basis of 250 families. Now we are addressing the needs of families, 3,000 families per day. It's unbelievable. The needs are there, but we are not getting the amount of resources. We have been promised, I won't say no, that people tell us, we have heard that it's coming, something is coming, but it's not here yet. In the meantime, we cannot keep turning away families and saying it's coming. But children are hungry, families are hungry, and there's a need for us to do something. And that's what we're trying to do. We have the facility, we have the possibilities. We are, like I said, hiring individuals, but listen, we're trying to get as many volunteers. It was very difficult to get volunteers in the beginning of COVID-19. They're more willing individuals to say, okay, I'll come out. And so they're coming out as many as we can get, but we still need the resources. And we need to hire, we have been hiring trucks, Joel. We have rented 2 trucks so far, and you know the cost plus the insurance for those, it is ridiculous.
So with the families that are coming to the campaign against hunger, are many of them also going to the school meal sites in New York City, or is that a barrier for them? I know that even with the 400 plus sites that are open in the city, you know, they're not meeting nearly enough the students.
So some are taking, some are actually going to those sites, but not everyone. So for some individuals, the sooner I can get out and get in is best for me. Others have, but I want to make this clear. We cannot give enough food to hold a family for a week. It is totally impossible. This is why SNAP, again, is the first line of defense when it comes to hunger. The pantries, the soup kitchens, we're out there, we are mustering up as much energy, and we're supplementing we're supposed to supplement needs, but we cannot eradicate hunger as it is. We need, the system has to be reinforced, or better yet, the needs have to be met through SNAP and other federal programs. But for us, we're doing the best we can. We give 9 meals per person, average 3 days. There's still 4 days of the week left. And that means that individual will have to visit us as much as every other day to maintain their families.
Great. So I know a lot of what Hunger Free America does as well is connecting people with SNAP benefits and WIC. We were just talking briefly before about the pandemic EBT program. Joel, can you just explain a little bit about the pandemic EBT for those who might not be familiar?
Okay, sure. So we have the SNAP program, which is the actual name for what some people still call the food stamp program. And that in New York City serves, I think, as of last count, something like 1.4 million people. So it's a huge program. Last year, it provided, I think, something like $2.5 billion in funding for food in New York City. Billion with a B. There's an old joke in Washington, a billion here, a billion there. Pretty soon you're talking about real money. And that was when the economy was still great in 2018. And the entire food economy in New York City is about $30 billion. So even a good time, SNAP is nearly like 1 in 11 food dollars for the whole city. So that program exists, and that program is going to continue to expand in this crisis because it's a so-called counter-cyclical. That's a wonkish, horrible term, meaning that it's designed to go up when times go bad and then go down when times are better, which the SNAP program has. Problem with SNAP is a lot of immigrants are ineligible for SNAP and a lot of working people are ineligible for SNAP, and the benefits aren't enough. So the second relief bill, frankly, it was the relief bill pushed most by Speaker Pelosi and the Democrats. I'm not being partisan, I'm just being factual. That bill created this, did two things. It gave extra allotments for existing SNAP people who weren't using the full SNAP allotment, which means not to get too deep in the weeds, but what it did is it gave more money to people who were sort of poor, but the poorest of the poor got nothing through that. Ridiculous policy, but that's what happens. Although in New York, it was $100 million boost in existing SNAP benefits. Then there's this brand new pandemic EBT program that basically says every parent with kids in public schools is going to get money on an EBT card, essentially a bank card, to be able to shop at a grocery store. And that will go both to parents who are already getting SNAP, but also to any parent of any kid in New York City public schools and most public school students throughout the state that aren't getting SNAP, but are low or moderate income. And so that is huge because kids of immigrants are going to get this food, and some working class people who were prior to this crisis earning a little too much to get it. If the federal government truly approved the plans of the state, it's about 1.7 million kids statewide, which would probably be at least 800,000 in New York City, and statewide would get over $700 million in food benefits, which would be at least a few hundred million for New York city. So I don't know, Dr. Samuels, what your budget is for the year, but that's a whole bunch of your agencies doing that. So we need both, but it just reinforces my point about the massive scope of the federal safety net. And lastly, we are pushing to get Congress to further increase SNAP benefits, to increase existing benefits by 15%, which would only be about a 25 cent a meal increase. SNAP is now about $1.34 per meal. This would make it up to about $1.60 per meal. And yet, frankly, the president and Republicans in Congress are opposing it. I'm not being partisan, I'm just being factual. That the Democrats are supporting it and they are opposing it. And so I'd urge anyone watching to get on the phone today and call 202-224-3121 to ask your senators to really push to get the extra SNAP increase and to ask your congressperson to do that. Long answer, but it's an important thing because it not only helps fill grocery carts and also SNAP can be used at many farmers markets, which is pretty critical, but also it helps keep people employed. And our top goal should be keeping people off of Dr. Samuel's line. And if they keep their job and hopefully have enough income, they earn enough to pay for rent and food, it would be great to keep as many people employed as possible.
Great. So Dan, what how has Brigade shifted its operations, and what are you seeing in the school districts where you work?
Yeah, I mean, we work we work in different areas. We work with school districts in different ways. As I mentioned, we're working with senior centers now. And I think something that needs to be mentioned during all this, obviously we're here talking about the hunger conversation, but what's very interesting and always a challenging thing is that a lot of the folks that work in these institutions like schools, they are in positions where they are struggling themselves, and they're working. And right now, one of my biggest concerns in general is their well-being. Quite frankly, when everybody's showing up to work, they're not, now it's better, a few weeks into this. But when it first started, is like, are people safe? Do they have proper PPE? No, they don't. Obviously the conversation now is there's a lot of people out of work, and particularly if you want to compare restaurants, for example, okay, I come from the restaurant world and it's a shame. People are out of work and it's a shame. But I will say that the people who are working in food service right now are working in a very challenging environment. And right now it's the balance between feeding as many people as possible, using as few people as possible. And that's tough. Obviously you want people to work, you want people to continue to get paid because they need to, but also too, a lot of the employees who are working in these institutional food service environments are over the age of 60. Many of them have pre-existing health conditions. There are a lot of people who shouldn't be working, quite frankly, but they're there and they're working every day. So our big focus is how do we prepare food? How do we prepare as high quality food as we can, feed as many people as we can? And those numbers are increasing all the time. They continue to increase as people continue to lose their jobs. There's more people in need every day. So we're ramping up production. How do you continue to do that and make sure people have access to the meals? So in the places that we work, meals are now being delivered, for example, in New London, Connecticut, which is this tiny little town of 25,000 people. We are delivering meals on a school bus to 36 individual sites to give people as much access as possible. So they don't really have to go far, and they can come, and also kind of eliminating the amount of times people have to come out. So we're delivering meals. First of all, we're delivering enough meals for 7 days a week, but we're also delivering meals that they only have to come out twice a week. So it's a combination of meals that are fresh. It's a combination of meals that we've made from scratch and then have frozen. So for example, on a Friday in New London, they're delivering 10,000 meals for really what is only about 1,500 people who are getting them, but making sure people have enough meals and eliminating the amount of contact. I mean, operationally, it becomes a lot more complicated. And like I said, my biggest concern is you have people who are working and basically making these programs work every day, these federal programs, making sure people get fed. And they're really putting themselves out there on the line. And it's a shame in that the response wasn't better from the government in terms of making sure these people were in better positions, but in terms of safety. And that's what we try to work on. I mean, it's just trying to figure out how can people work and stay safe at the same time and also make sure people are getting fed. It's a balance, it's a balancing act. So that's kind of, during the school year, our luxury, even though it's a difficult space to work in, is to try to make school food as best as we can. And now that luxury has gone away in the sense that if we need to take a few steps away from a certain dish that we make, then we're going to do it if that means that people will be safer. And it's this balancing between making sure you feed people as best as you can and as many people as you can while keeping everyone who's working safe. And that's a tough balance. And that's also, when businesses start to reopen, when food service starts to reopen, it's going to be a big, big thing that there's a lot of question marks about right now. How do you work in food service during this time? Very challenging.
And just to ask you, Dan, that's amazing work you're doing in New London. How does the number of meals you're serving to kids now compare to what was happening during the school year? In New York City, I think they're only hitting about a quarter. The kids they were hitting before. One school food service contractor who serves 600,000 meals a day a few weeks ago, he was saying they're only hitting 12% of it. It seems like you're doing better than that, but you have a sense of what the daily number of kids are eating school lunch versus what you're able to do?
Yeah, that's a great question. And actually I think what is a great comparison, actually, it's a little more apples and apples, is if you compare it to last year's, say, summer feeding. So, because it's done in the same way. So summer feeding, these are kids who have to show up to get meals because they need meals. And that summer feeding is typically tied to programming. So these kids are getting meals if they're actually doing something in most cases, where the meals now are not tied to any programming. And we're at least double the amount of meals that we would typically serve in the summertime, say in New London. In New London on a daily basis, they're serving about 2,800 kids. And now they're serving about 1,400 kids a day. And to think that there's no programming, no school, nothing tied to this, it's a huge increase. I mean, it's actually kind of crazy because, like I said, in summertime last year, we would have been doing half the amount of meals that we're doing now. And that meal count continues to increase. And that's where the challenge comes in, because it becomes logistically extremely challenging to get all these meals out. But it's a number that is significantly higher than it usually is, considering that it's not tied to anything. Now, part of that can be attributed to the fact that they've waived the biggest rule that governs summer feeding, which is the Congregate Rule. So during the summer feeding programs, as you know, and for everybody who doesn't know, if you go get a meal at a summer feeding site associated with a school, you have to stay there and you have to eat it. And you as a student, you have to be present. So it's a meal for anyone under the age of 18. Obviously, the idea of congregation is frowned upon now. So now a parent can go pick up meals for their kids, and the kid doesn't have to be present. They don't have to eat it there. So that also encourages, higher participation. But at the same time, the fact that there's no programming or no school involved, it's literally just people showing up to get food. It says a lot about the current need of things. Yeah.
So just to be clear, what you're saying is you're serving more people now than would be over the summer, but less kids than would basically being served during a school day.
Correct.
And the basic issue is when you have a school day, you have a captive audience.
Right.
Over the summer, you don't, but and you're literally delivering this to kids' homes. Are you also able to feed the parents at the same time?
So that's a school district decision. So in New York, they've made this decision to do that, which to me is the right decision. And from the federal level, that should have been the decision from day one. And I'll tell you why. One, because quite frankly, if parents are allowed to come and pick up meals and no kid has to be present, there's really no way to account for anything. There's no way. So at this point, anybody can come and get any meal. So why not just let it happen? Right. And let people get fed and reimburse schools appropriately? Because I'll tell you what, like the accountability system within school food is very difficult. And I know there's a lot of food service directors out there in schools who are nervous because it's very difficult now. Who's taking meals? Who's not taking meals? Are they students? Are they not students? So in New London, that's not the case. These meals are supposed to be for people under the age of 18. And it's a district thing. It's a district by district thing. If the money's there, the money's there. They can do it. But from the federal government, they haven't, they're not saying they're supposed to be reimbursing people over the age of 18. So I'd be curious to understand. I don't know, like in New York, where that funding will be coming from. I think they made the right decision and just said meals can go to anyone. I think that's the right decision, and you figure it out after the fact. But I'd be curious where ultimately that money's going to have to come from. But to me, that's the absolute right thing to do. But if you're a school district, say a school district like New London, or for that matter, any school district, if there's no budget for it, first of all, another thing to remember is the reimbursement rate for meals right now is the same as it would be for summertime. The fact of the matter is, logistically, the way meals have to be distributed now costs more money. You're putting them on buses, you're paying bus drivers, you're packaging them. There's lots of packaging. It's significantly much more money. A lot of school districts are continuing to pay all of their food service staff, even though a fraction of them are working, and that's the right thing to do as well. And they're making a fraction of the amount of revenue. So the fact of the matter is, come September, a lot of these school food service programs are going to be completely in the red. These are already programs that struggle already, and they're going to be completely in the red. It's a really challenging thing. So you're not really, don't really have the luxury as a food service program to just say, well, we're just going to give meals to parents as well. I wish that was the case. New York obviously has the ability to find money, I guess. A lot of small districts don't, and there's a lot of pressure on them, unfortunately.
Yeah, and can I just say that you made an important point about the workers, that we are we have a real double standard. We say workers are essential,
Yeah.
but at the same time, our society is basically saying they're expendable.
Yeah.
That we're going to put them out there into these dangerous positions, not give them personal protective, equipment, not allow them to work in social distance places, not necessarily guarantee them health care or sick leave.
No, I mean,
and pay them like crap.
To put it in perspective, and this is just a small example, we started working in a senior center, and we were in a position that we could actually hire 6 people to come work in the senior center with us. You know, my network is primarily in fine dining restaurants. That's where I came from before I started doing this. And a lot of my friends and peers and colleagues are, upset because they're out of work. And we advertised that we were hiring 5 to 6 people to work in the senior center. This was 3 weeks ago now. We got like 2 applications, and we have a pretty big following of people. As much as people were like, oh, we're out of work, we're not working, nobody wanted to work. Why would you want to work? Because it was very unclear. I mean, it's still unclear as to what's right, what's wrong, how should you be working, how shouldn't you be working. So these folks that were out there doing this work, I mean, the other thing is, like, I've heard this many times, they're talking about masks, getting proper masks, right? Proper masks should be reserved for people in hospitals. Okay, fair enough. But what if you're showing up to a school every day to work every single day, to cook food for people in need? I think you should also very much have the right to have proper masks and proper. So it's a really difficult thing, and it kills me because I don't really think people are celebrating. People are like, oh, this is great, but I don't think people really understand the gravity of like all these people that are showing up to work. And again, many of them are probably not the people who should be working every day in this condition. Right.
So A, they're required to work. B, especially if they're feeding with kids, they believe in the mission.
Yeah.
And C, if they don't work, their own families could go hungry. And particularly if they're undocumented immigrants, there are probably very few undocumented immigrants working for school districts, but certainly for the rest of the food industry, sure, they're in a ridiculous bind. Nicole, there were 1 or 2 technical questions we got, and this relates. One of them relates to what Dan was saying. For those of you not in the hunger business, just to try to explain even more lay people's terms, is different programs are funded out of different pots of money. And so many of the school distributions now are funded out of the USDA child nutrition programs. Right. And because of that, under current federal law, they are not allowed to be used to feed adults. And that's this ridiculous thing that they can deliver the food to your home, but theoretically the parents aren't supposed to eat it. Right. New York City is doing that because they've made the extra decision to use other money, which they may or may not get reimbursed, to feed adults. There's also a technical question about when something becomes an open site under the summer food service program. Not to get, again, too deep in the weeds, but you have to have a poverty rate above 50% or more. And someone asked, what about places that are not 50% or more? Are there efforts undergoing to deal with that? Yes, I don't think we've succeeded yet, but there are regulatory efforts in getting USDA to waive stuff, as well as some legislative efforts. That person asked the question was anonymous, but if you want a more detailed wonkish response and exchange, I won't put everyone else to sleep here with the detailed discussion of the provisions of the Child Nutrition Reauthorization Bill. So just email me at jberg@hungerfreeamerica.org, and I can answer that technical question at jberg@hungerfreeamerica.org. There's another question from our friends in San Diego about the online pilot project. And I won't go too deep in the weeds of that, but basically, until very recently, you could not use SNAP benefits to order food online. There have been some pilot projects to allow that, but by and large, it's only been Walmart and Amazon that have gotten approved to do that. And we're very grateful for the supermarket industry that's been generous to Hunger Free America and other entities, but we still say this needs to be expanded. There was a question about the high delivery fees, and I should let you know that Senator Gillibrand, the junior U.S. Senator from New York, did send a letter to the CEOs of Walmart and Amazon asking them to waive the delivery fees. They did respond and politely declined, but I did suggest an alternative is, again, not getting too technical, but to allow families. So in much of the country, you need to buy $35 or more to get free Amazon delivery. In New York City, it's $50 for depending on the kind of Amazon delivery. And I've suggested to both the companies and to elected officials allowing families to batch that. And in other words, there are 3 families in the same apartment building. Could they, if they all got $20 worth of groceries, then could that meet the $50 delivery fee requirement? At least some of the companies are saying they're looking at that. In addition, there's a move in Congress to see whether Congress and the federal government can pay for some of the delivery fees, but that also wants to be balanced, that we don't want to end up giving corporate welfare. Like right now, the biggest companies that can accept SNAP are some really big companies, and Amazon's run by the richest person on the planet. Do we essentially want to be subsidizing him by helping low-income people get groceries? On the other hand, we don't want to penalize low-income people if the only place they can get delivered groceries is Amazon. So there are some really tough balances here. But if our friends in California want to discuss this more, send me an email as well at jberg@hungerfreeamerica.org. And it's interesting, these calls we set up, we always aim these at the general public, and then there are a lot of ringers on these, a lot of experts working for other hunger groups. But we're happy to answer questions from both the general public and fellow activists. Sorry to give such a long answer, but I was trying to, people did ask.
Yeah, so obviously we've been talking about, the importance of SNAP. Dr. Samuels, do you find that a lot of the people who are coming to the Campaign Against Hunger, have they been able to apply for SNAP and other benefits, or is the system just so backed up right now that they haven't been able to receive, if they're newly eligible? What has their experience been?
It's been a slow trickling in because of the social distancing, it is very difficult. So we do have 2 staff members that are presently working with individuals online that have expressed their needs for SNAP. So that has been working. Which is still down for us. Last month we did 22 new SNAP benefits, which is not bad concerning when you put all the factors together. It's very difficult, and I think we have far more individuals eligible. Like it's we're working on the census also. It's become really difficult because of the social distancing, but we're doing what we do best. For instance, some of the changes we made is shopping online for food, as I heard Joel speak about that. We have seen a vast increase in individual shopping online, then coming and just picking it up real quick and leave instead of staying online. So where SNAP is concerned, yes, we are continue to service those who have interest. We can continue to put it out. And I think after a while, where we were 3-4 weeks ago when nothing moved, everyone was too concerned about their health in the sense of they don't know if they should come out or not come out. We see a difference in that, in so much so that our lines now will have 800 people online. Before it was, we would have 400 or 500. Now that has increased. And I think there's a lot of changes how people approach the whole thing. We also try to make sure that individuals have masks if they don't. So we're working on the SNAP problem because we know it's really one of the main ways to alleviate hunger. And that department is still open. We have individuals working at home and in the office.
Great, thank you.
Do you want to go through the other online questions?
Yeah, so Joel, somebody asked, I think they're referring to pandemic EBT and asking if undocumented families are able to get those.
Yes, Yes, undocumented families can get pandemic EBT, and that's why it's such a crucial program. And we believe the way it's going to work in New York City and New York State, at least, is that they're not even going to have to apply. That if they have kids in public schools, they're automatically going to get a card sent to them. So they're going to have to look for that in the mail. And if anyone has any questions about this, particularly hungry families, and you can call the National Hunger Hotline that's run by Hunger Free America at 1-866-3-HUNGRY. That's 1-866-3-HUNGRY. And we have staff who speaks English and Spanish that can help people understand how they can use these benefits. I should also add that we have an AmeriCorps Vista program. Dr. Samuels had some Vistas with us in the past. I know we have summer program this summer, and we have a year-long program. And if anyone is interested in possibly getting someone either through the summer or the year, this is a national service participant who basically works full-time either over the summer or year-long, helping hunger groups build their capacity, and in summer doing direct service. You can email me about that as well at jberg@hungerfreeamerica.org.
Great. And somebody also asked, are there any outreach programs right now for families in shelters?
So at least in New York City, if you're in a city-run shelter, you should be getting food there through the city. If they are not, let us know. That is the issue. Someone asked the amount of the emergency EBT. That will be about $5 per parent per kid per day.
Yeah, it's $5.70. Yeah.
So over that, so we will get that out to you. And someone asked, are there flyers about emergency EBT to hand out with food pantry bags? We have urged the city and state to do so. And if they don't, we will provide at least samples to that. The PEBT cards should be issued, at least in New York, sometime over the next few weeks. The people who already have SNAP can get them sooner. Maybe Dan can answer the question about schools and paying the bus drivers.
Yeah, I mean, I think one thing people need to realize, first of all, that decision. So the question here is, why aren't schools paying for things to happen, getting food delivered and so on, and why is it coming down to food service budgets? The way it works in school food in most districts, first of all, the money that comes from the government to reimburse a meal has to be exclusively used to produce that meal. And in most food service programs in the country, that is all the money they have to produce that meals. In some school districts, the school district actually will charge the food service program for utilities to use the kitchen to make it even worse. District by district, they're making this decision. So if a district wants to, from their own general budget, pay the food service program or pay for things like bus drivers and buses to deliver meals, they can do that. And some are doing that. But there are many school food service programs out there that are kind of on an island. They don't receive much help during normal times. They're not receiving much help now. They need to use their own budgets to make things happen. And that's just unfortunate of a way it works, because food is just considered not that important of a thing in the scheme of things when it comes to a school's budget overall. So it's a challenging thing, but that's the nature of it.
Can I just explain a little more what Dan said, because it's sort of counter, intuitive, but that school meals authorities or the part of the school district that creates school meals is often thought of to be this quasi-independent money-making venture, which in my mind is just insane. It is part of the government. We know teaching isn't a money-making venture. In the vast majority of school districts, the music programs aren't money-making, ventures. I played a very awful French horn in high school and was given a free one by my school district. You were very lucky you didn't have to hear that. I played a very mediocre, soccer and was given a free jersey by my school district. It won't shock you to know I was better on the debate team than I was either in band or on the soccer team. And the idea that we understand that sports And music, and not as much with music as it used to be, but in many places understand that those are key components of education and don't understand that school meals are a key component on education, and that we put pressure on school meals authorities to somehow make money, puts a lot of pressure on them to serve less nutritious food that may sell better, takes a lot of pressure on them to possibly cut corners on food safety, to underpay their employees. So it's just an insane mindset overall. Would you agree with that, Dan?
100%. I mean, literally, first of all, that's the reason why we do what we do, is because the whole system is set up for it to be so challenging to make. First of all, to even just make a meal. Just to give people an idea, lunch this year, the reimbursement rate is $3.41. $3.41 is to cover everything to produce a meal. Comes down to about $1 to $1.25 in food costs to produce a meal. That's really challenging. And then you're following very strict nutritional guidelines. And then you're trying to make food that tastes good. That's really difficult. And in those parameters, you're not paying people enough. First of all, you're not paying your staff enough money, period. And then beyond that, it's really difficult to keep staff. If Walmart opens up, in a town, then everybody leaves and goes and works there, because they're not going to work in a school, because they're not paying people anything. So it incentivizes to cut corners, like you said. It incentivizes to pay people less money than you should pay them. It really makes it such a challenging job for those folks that are involved in it. It's just very difficult.
So we got one question here about the HOPE Act, which was just introduced yesterday by Congressman Morelli and Senator Gillibrand.
It's actually introduced a few weeks ago, but they just publicized it yesterday. They were all about to put out the press release, and then the crisis broke. So the HOPE Act is a bill that's based on something Hunger Free America has been pushing for years, to make it easier to apply online for wide variety of benefits. SNAP, WIC, unemployment, Section 8, Pell Grants, to be able to file your income taxes online. And when we say online, we also mean via a smartphone or a tablet. And we're hoping that will be included in any major bill that is considered by Congress for relief. Right now, there's a huge backlog of people applying for unemployment compensation, a huge backlog of people applying for SNAP. In New York City, we're actually in relatively better shape than the rest of the country, because they've taken our advice and already moved to online stuff. But in a lot of the rest of the country, they're even worse shape. So that's important. The questioner may be conflating a few other things that aren't in the HOPE Act, that the issue I mentioned about online ordering through SNAP. That's something we want to expand both legislatively and administratively. And then there are two issues related to hot meals. One is, in the existing SNAP program, you cannot use your benefits to buy anything that's hot. And so if you are at a supermarket and there are two roast chickens in the supermarket, they're right next to each other, exact same cost, exact same brand, exact same size, one's hot, one's cold, you can buy the cold one, you can't buy the hot one, even though it will cost the low-income person more money to take the cold one home to heat up, because they'll have to spend money on electricity or gas to do so. Why? Because we have this really patronizing notion that somehow hot food is a luxury that poor people, don't deserve.
Don't deserve.
And so that's something we could change overnight, and that wouldn't cost the federal government a penny. Just expand what can be bought with SNAP. The second is a more complicated issue that in a few states, some restaurants are able to accept SNAP for small populations, basically people with disabilities, senior citizens, and homeless people. And we believe that it should be far easier for restaurants of all types to be involved in the programs, particularly restaurants that have moderate prices in the low-income neighborhoods, and that's something else we're pushing for.
Great. And so people have more questions about pandemic EBT. So for families who currently don't receive SNAP, do we know yet how they're going to be receiving those benefits and EBT?
It's going to differ by state, and each state has to come up with a plan. In some states like Michigan, families who don't currently get EBT or SNAP are going to have to apply for pandemic EBT. Assuming USDA approved the plan that we've seen for New York, then you won't have to apply, and they will just actually be able to get the card issued to them. And so that would be for immigrants, non-immigrants, or anyone not currently getting SNAP, but kids in public schools. And someone asked for Dan's contact number. I would prefer to send them you send us privately to myself, Berg at hungerfreeamerica.org, your contact information, and we'll pass that on to Dan and let him decide. There's sometimes real trolls on this line, sometimes including, horrible racists or anti-Semites. So I trust you're a wonderful person, but I'd prefer not to give out anyone's phone number on this call. But I have given out my email to send all the trolls and racists and Nazis to me. I'll give them a what for.
Dr. Samuels, did you want to address the comment about the food bank in Virginia and the massive increase that they've seen?
Well, it's what everyone is seeing, not just them, but New York City, as you can imagine, we are inundated with a lot of families that need food. We have gone, the only thing I can say is that as much resources as you have, use it to the best of your ability. We have, as we're getting ready to close, I just want to say, we have approached COVID-19 so much far more differently. We are presently serving 50 different sites in the city, including homeless shelters, senior housing, NYCHA housing. So our approach is far different. I mentioned the online service, but we're doing home deliveries for seniors, those that cannot come out because of their age. We're going door to door. We're traveling. We're taking bags once they order. We're going out or they give us a call. We have even a hotline set up for those that need to understand what is going on and how best to access food. So I would say to them that each food bank has its own capacity, knows its neighborhood, know the best way. I don't think it's a one size fits all that everyone can do the same thing another food bank is doing, but is to know your community, know the need, and do the best you can with your staff, still keeping that social distancing, making sure your staff is as safe as possible. As a matter of fact, for us, our staff is willing for us to take their temperature before they start working. We ask permission, is it okay? And they say yes. And so we want everyone to be secure, and so far so good.
Great. So we have kind of an overarching question about what kind of food system policies would you like to see change as a result of the pandemic? And so obviously before the pandemic, there were, tens of millions of Americans who, were still food insecure, but the pandemic has really brought poverty and hunger into the national conversation. So do you see things changing for the long term, and how do you see that changing?
That's me.
Whoever wants to jump in.
Go ahead. I've spoken enough.
I think this is a lesson learned, and I think it's time that our government wake up from sleep and slumber. Sandy was a test run for us, and we still were not prepared. And here we are again. COVID-19 has really impacted us in such a way. It is time for the experts and policymakers to sit down at the same table and start making decisions that will impact our nation on a whole, not just small communities, but we cannot approach it the same way. I agree that it is time for us to move. Joel has been championing a lot concerning, SNAP, how best to approach. And we as food banks need to get together, also sit at the table and begin to work on a plan immediately. I think this should start even before we get over this hump, which we don't know when this will end, but it's time for us now to say, okay, what changes can we make that will impact that we never get to a place where we are not ready? And it's sad to say we were not ready and we have been warned, and I called Sandy a warning. We were devastating then, and we are double devastated now. We cannot wait for another pandemic or anything else. You know, we are approaching the hurricane season. I don't know if anyone remembers that. And anything can happen. We can have a Cat 5 that hits at some level. With what's going on and a hurricane season coming up, we are not ready. It's time for us to buckle down and get busy.
Dan, you want to weigh in on the broader impact on food systems and policy?
Yeah. I mean, I think, you know, speaking of what I know best, and that's been, you know, institutional food and more specifically to child nutrition in these programs, like there just needs to be, like, there's no plan. Like in this case, they basically just adopted the summer feeding program and that was it. Like, it's just not good enough. And until now, when there's a disaster and people need to be fed, it's reliant on philanthropy and people coming out of the woodwork to make things happen. There should just be a system in place that says, okay, when something happens, this is how we're going to feed people. And like, it's kind of crazy to think, but there's just no system for that. And I don't like it's almost, it's nuts to think that that's the case, but it is the case. And we've been able to get by because usually these emergencies don't last that long. And now here we are in this situation, and, you know, they're talking about it. Who knows what's going to happen in the fall and winter. And then of course, as Dr. Samuel said, we're going to hit hurricane season and what happens then, and things get compounded. But simple things like we talked about, you know, not putting any extra thought into the fact that, okay, if we're going to produce meals for schools, the reimbursement rate should be slightly higher. It's simple stuff. It's not, you know, there's a lot of bigger themes that of course can be addressed, but it's almost a lot of the things that we're seeing now are just thoughtless. It's just adopting things that were kind of there. And not really saying to ourselves, like, man, we should probably give a little extra money just because of this is going to happen. So we'll see. I mean, I think there's a lot of huge things that need to change, but in a very practical way, there's a lot of very small details that can just be changed that I think would make these things much smoother, particularly, again, with these federally reimbursable programs. But I'd be curious to understand how it happens, or even the idea of reimbursing adult meals, just saying, okay, if you want to feed adults and you're a school, you should be able to feed adults and get paid for it in times of emergency. It's a simple fix. It's a simple thing that could really alleviate a lot of pressure, you know, just stuff like that.
Yeah, that's all great. I'd say, to me, the $1 million question about this crisis is, are we going to react in a superficial manner that kind of sort of a little helps us get back by the temporary worst problems? And that's sort of what we did in 2008 and 2009, where we had the economic collapse. We briefly raised SNAP, a little, didn't change structural things in the economy, briefly got people a little more, healthcare, but didn't really fundamentally restructure things. Or are we going to take this opportunity to do something bigger and bolder so we don't have massive problems every time there's an issue? Every country on the planet has COVID now. Not every country is suffering equally. Now, I won't go into, this from my personal opinion as a citizen, the mismanagement of this by the federal government, from the downplaying it to saying we should drink Clorox, et cetera. But on the broader issues of that, make no mistake about it, part of the problem is that we don't have a serious system of unemployment compensation and a serious system of benefits that track with the employee as opposed to the employer. And so as restaurants have lost tens of millions of employees, Walmart has hired a few 100,000 employees. The Albertsons supermarket chain has hired, they have Safeway as well. They've hired over 50,000 employees. And I assume, since most healthcare goes with the employees, they lost the healthcare for one job. And then when they got the new job, if their new jobs even have healthcare, they had to sign up to the new system. And so we need a whole benefit system aimed at the 21st century with portable benefits, with universal health care, with universal sick family and medical leave, with affordable daycare and childcare like every other industrialized Western country on the planet has, except us. That's number one. So I hope we rethink that. I hope we rethink the food safety net and how difficult it is and how we micromanage it. That not only can a parent not get fed at most child nutrition sites, something like 10% of the kids in America are being fed by their grandparents or being raised by their grandparents. So if the kid shows up at a senior center, the kid can't eat. It's because we so distrust hungry people that we want, okay, here's this benefit for kids, this benefit for seniors. God forbid we're going to let adults eat. And then when we look at the broader food system, how broken it is, that Dr. Samuels has lines around a long city avenue block, not a street, avenue block, and a Brooklyn Avenue block.
Well, Job, you have to put around that it wraps around
right.
From Fulton to Saratoga to Herkimer.
So how long do you think that is? Like half a mile? It's
a good distance.
It's a good distance for you non-New Yorkers. At the same time you have that, we have farmers throwing out milk, pouring out milk down the drain. And so one of the things we propose for the long run is a system of regional food processing facilities. Because right now, food processing is just so centralized in America. And sometimes we're shipping produce grown in New York or New Jersey to the Midwest or California to be processed and shipped back, and that's sort of crazy. So we would hope there's a more fundamental fix of our safety net and economic system, a more fundamental fix of the hunger programs, and a more fundamental fix of our food system. But part of that is up to you, dear viewers. Number one is to vote for candidates who are going to do that. We can't tell you legally who to vote for or to vote against, but you should really educate yourself. And I will just say that if you think both sides are the same, you're wrong. I will just, say that. And so you should educate yourself and make an educated voting decision of this. And if you have time to donate or volunteer on the campaign of your choice that's going to do these things, do it. But that's number one. Number two, get your elected officials to do this. The power is really in your hands to influence our political system to do better and not just do the superficial, really deal with these more meaningful things right now.
Great. And I think I just want to address one last question, and then I think we'll wrap it up. Somebody asked, what can we do as a church to start getting food delivery for our community? And I think that ties into a larger question of just what can individuals wanting to help right now, what's the best way that they can do so?
Well, I would just say, if you're in New York City, I don't know that the best strategy is to get a church to deliver food and that the city of New York is guaranteeing they're going to deliver food to people who need it. So you can go to the mayor's website and sign up to do that. Hunger Free America, we're a so-called trusted enroller to get people on the list so you can contact that. And I would say my general advice around the country is work with an existing program rather than start a new one. Dr. Samuels can tell you just how difficult it is to start and maintain a program. Nationwide, there are between 40 to 50,000 soup kitchens and food pantries already. And so our advice would be to work with an existing one. But if you have a specific question about a specific locale, again, shoot me an email at jberg@hungerfreeamerica.org and we can respond to that. I see you nodding, Dr. Samuels, you agree?
Yes, definitely. It's not, why reinvent the wheel?
That's it.
Will help you. Usually we can help. And especially in a time like this is not the time to really start. There is resource when it comes to pantries and soup kitchens. You just have to tap in it. And as Joe just said, just reach out to him and he'll tell you. I think he knows everyone by name.
Not all 40 or 50,000 of them, but I'd like to someday, and I wish I was out there meeting them now. It's very frustrating to me that I'm not there every day on the lines, but I just think it really pains me because I feel I should be out there and visiting the pantries and kitchens and visiting the SNAP offices, but that's where my heart is, and my head says no, even if I'm still relatively young at 55 and have, hopefully good health, but I could be putting other people at risk. So my also message to you is for those of you not in New York, if you're reading news reports, this is overblown. It is not. all of us New Yorkers have loved ones who've been affected in very serious ways. I drove by a hospital the other day. You've seen the media. It's not fake news. It's real. They had a large truck outside the hospital. It's a makeshift morgue. And so I've been joking a little here, but this is, you know, a deadly serious time. And even for church deliveries, you know, there's some agencies using National Guard, et cetera. Many church volunteers are older Americans, and goodness knows we appreciate your desire to help. But let's make sure that the people who most help are the ones who are at least physically able to take the risk the most.
Great. Any other closing thoughts? Anybody wants to add?
I know the Associates Council of Hunger Free America worked with Nicole to put this together, so I want to thank you guys all. This is a great idea. If people find this useful, we can do, you know, follow-up conversations. We have learned to embrace this Zoom thing. You know, and we at one point we had over 100 people in it. Honestly, for a group like ours, it's rare to have events that get you know, more than 50 people at once. So if it's easier for us to reach people this way, we will embrace the technology. But we thank you guys for the ideas. As long as people out there find this stuff to be useful, we will keep doing this. And for Dr. Samuels and Dan, just, you know, massive, you know, thanks for not forget appearing on this, which with your valuable time, but the work you're doing on a daily basis. Do you guys have any closing comments?
I mean, thank you very much. Obviously, it's always great to be able to have this conversation, and we take it for granted. I think that we're in this conversation all the time, and there's clearly a lot of people who are very interested to understand more about it, and that's how things change. For more people to understand how things work, how they don't work, and I think there's a lot of misconceptions as to how to do things, and also how a lot of these folks can help other people as well. So I appreciate the opportunity to get to talk.
Joel, Dan, and Nicole, thank you for the opportunity to share. Again, to everyone, I would say be safe. As Joel said, this is not a gimmick. It is real. Let's be safe and be, as much as you can, reach someone else, check on someone that is in your neighborhood, make sure they're safe also. And of course, we're here, Joel is here. Hunger Free America has the information and the know-how. It's a trusted organization. I say that you reach out to them. Thank you all.
Thank you.
Thank you, Dr. Samuels. Thank you, Dan and Joel, Dr. Samuels. And thank you for everybody for joining us. All right, take care.
All right, thank you.
Bye.
Bye.